Tonight on 60 Minutes, we will be investigating the various functions of state and federal healthcare agencies. We will begin by looking at the U.S. Department of Health and Human Services. The mission of the Department of Health and Human Services is to enhance and protect the health and well-being of all Americans by providing effective health and human services and fostering advances in medicine, public health, and social services. This is accomplished by providing Americans with the building blocks needed to live healthy, successful lives. The department is headed by the Secretary of Health and Human Services, who is appointed by the President. The next four federal agencies we discuss all fall under the authority of the Department of Health and Human Services. Our next segment investigates the roles of the Centers for Medicare and Medicaid Services. The Centers for Medicare and Medicaid are an agency within the U.S. Department of Health and Human Services that administers and oversees Medicare, Medicaid, the Children's Health Insurance Program, or CHIP, as well as the state and federal health insurance marketplaces. CMS collects and analyzes data, produces research reports, and works to eliminate instances of fraud and abuse within the healthcare system. Through its Center of Consumer Information and Insurance Oversight, CMS plays a role in the federal and state health insurance marketplaces by helping to implement the Affordable Care Act's laws surrounding private health insurance and also provides educational materials to the public. In this way, CMS plays a role in the private sector. Next, we will investigate the role of the National Institutes of Health. The National Institutes of Health is another agency found within the U.S. Department of Health and Human Services. Their mission is to seek fundamental knowledge about the nature and behavior of living systems and the application of that knowledge to enhance health, lengthen life, and reduce illness and disability. More specifically, the NIH provides leadership and direction to programs designed to improve the health of the nation by conducting and supporting research in the following areas: in the cause, diagnosis, prevention, and cure of human diseases, in the process of human growth and development, in the biological effects of environmental contaminants, and in the understanding of mental, addictive, and physical disorders, and in the development and support of medical libraries, which includes the training of medical librarians and other health information specialists. This next segment investigates the roles of the Centers for Disease Control and Prevention. The Centers for Disease Control and Prevention works 24/7 to protect Americans from health, safety, and security threats, both foreign and in the United States. CDC fights disease and supports communities and citizens to do the same. CDC conducts critical scientific research and provides health information that protects our nation against expensive and dangerous health threats and responds when these threats arise. Currently, the CDC is closely monitoring the coronavirus outbreak and preparing for the potential of community spread in the United States. CDC is continually working with state and local public health departments to ensure all communities are prepared for these various threats against our nation.